good day. I am Doris Hemi Bernadette PB Julia from BS1021. So today I'm going to demonstrate the catheterizing of both female and male urinary bladder. So this is the goal, is to safely introduce the catheter into the bladder to promote urine drainage. So what are the things we need? Of course, we need the sterile catheterization kit here, which contains the following: the sterile gloves, the drape, the cotton balls, the lubricant, the antiseptic solution, the basin, the perineal light, the prefilled syringe, the indwelling or straight catheter with their appropriate size, of course, and then the specimen container, and then the green bag with drainage, this disposable bag, and the waterproof pad. Now let's proceed. So for the procedure, of course, you have to assemble the equipments we have here, and then perform hand hygiene, of course. It is a must to perform this. And then you have to explain the procedure to the client or to your patient, and then also discuss that there will be allergies, or discuss the allergies, especially with iodine or latex. Then after that, you have to use the artificial light. Is very recommended when using this because it helps to, or it is recommended for holding and position. And then, of course, you have to provide for your client's privacy by closing the doors or the curtains. And then, for the female, you can position your patient in a dorsal recumbent position with their knees flexed and their feet are about 2 feet apart. And for the male, you can position them into a supine position with their legs slightly abducted. Now, let's proceed. So first, you have to clean your patient's genital area with warm soap and water. Okay, there you go. And after that, so now open the sterile catheterization kit and then put on your sterile gloves. Always the sterile technique, guys. And then the other part. Okay, so now once you successfully wear your sterile gloves, so now you can place the sterile drape over the perineum, which is already here. I just put it already because I'm afraid the one. And then put them over the perineum. And then place the tray on between the patient's thigh. And then with my thumb and one finger, so I have to spread the labia and find the meatus, or identify the meatus. And then cleaning the labia folds using the catheter and this one, the cotton balls. So I'm going to use the cotton balls, of course, for cleansing. So clean the labia folds from the meatus toward the rectum. So after doing that, you have to discard this. Okay, there you go. And then you have to lubricate you can lubricate, or wait, rather you have first to inflate your balloon, or your indwelling catheter. So here I'm going to use a 10 cc syringe to check if the balloon inflates. So let's find out if it will going to inflate. So it does. So it is okay. Now let's deflate it. There you go. So I'm going to leave the syringe on the attachment port. And after that, you lubricate it by 1 to 2 centim or 1 to 2 inches. So we have already lubricated, and then after doing that, so you have to insert now uh, the catheter into the meatus. So there we have here. So always remember to gently insert this. Do not use force because you might damage the urethra. And then if there are any resistance met, just ask your patient to deep briefly. I want kindly deep briefly so we can insert the catheter properly. Okay, thank you. Thank you, ma'am. And when the urine drainage, you have to uh, advance, or you can advance your catheter for another 2.5 to 5.0 or 1 to 2 inches. Oh, by the way, remember that to insert the catheter into the meatus has to be 7 to 7.5 or until the urine flows. Okay, we're done with the female rather. So next is for the male. So with the same procedure, you have to lift your client's penis. For example, this is the penis. So lift it in the perpendicular position, retract the skin, and then we also have to clean it on a circular motion using again the forceps. So there you go. And then lubricate a 10 ml lubricant into the urethra. There you go. And then after that, you have to insert the catheter about 6 to 8 inches. So we're going to insert it again. Okay. So when you have successfully inserted the catheter, so you're done for the male and female. Now for both male and female, of course, if the catheter is to be indwelling, you have to test it or inflate it 5 ml or still according to the agency protocol. And then after that, so tag on gently the catheter after the balloon inflated, then check for secure their thighs, and then leave some slack so the legs can move. And then check for the bed rails, or if it's not blocking the catheter bag, and then put the catheter on below the bed of the bed. Okay, and then after that, of course, we have to clean the perineal, the genital area, and then remove all the used equipments, do the aftercare. And after that, of course, perform hand hygiene, remove the gloves, then do again the performing of hand hygiene. So by washing and by using the alcohol. And after that, so document now the amount of urine, the type of catheterization, the description or color, and then the reaction of the client toward the procedure, and your name. Thank you for listening. I am Therese Hempburn, your soon-to-be nurse. Thank you.